now I'm going to talk about diagnoses and investigations for cancer. And cancer's a lump, and it's traditionally diagnosed by imaging, and imaging can take lots of different forms. So MRIs can be used to image specific organs, such as the brain or the liver or the pancreas, and CT scans can be used to image the whole body. But sometimes we need other investigations, so these scans aren't very good at looking inside tubes, and by tubes I mean, for example, your gastrointestinal system. So sometimes people need endoscopies with an endoscope, either an upper GI endoscopy, which can look down the esophagus and into the stomach and into the small intestine, or a colonoscopy or a flexible sigmoidoscopy, where a tube via the tail end looks all the way through the colon, or some of the colon at least, after the colon's cleaned out with drinking solutions. Now, once cancer is suspected by imaging, and other imaging modalities include mammography or bone scans, and the list, or PET scans or radio labeled scans, the list is long. The point is that really we need tissue to make a diagnosis. So there's this old adage, tumours the rumour, tissue's the issue, cancer's the answer. I will not treat or see anyone without a tissue diagnosis of cancer. Of course I'll see them and help them make a tissue diagnosis, but I won't embark on a treatment plan, because many times cancer is suspected but it turns out to be a benign lesion. That means a non-cancerous lesion or non-invasive cancerous lesion. It might be a pre-cancer, but it won't spread, and it might continue to grow, but it won't kill people via spreading. So what I mean by taking a biopsy is taking a piece of the tumor, and in the old days people just used to feel it and stick a big needle in it like an apple core, but now it's done much more accurately. We use ultrasonography or CT guidance to exactly tell our probes where to go. For lung cancers or colon cancers, you can see them with bronchoscopy or colonoscopy respectively, and you can insert little biopsy forceps down those telescopes to take a piece of the tumor. Then what happens is that piece of the tumor is placed in formalin or salt water, and it's taken to a pathology lab where it's fixed. The cells are frozen at that point in time, although they're not usually frozen. They're just freeze-framed, if you like, and the pathologist looks at it with various stains, and what we're looking for is uncontrolled cellular proliferation. That means dysregulated cell growth. That means cells not doing things they should be doing. So an example of that would be when cancer is looked at down the microscope, we see many cells dividing, and when normal tissue is looked at down the microscope, we see only a few cells dividing. And so when we suspect cancer and we stain that tissue for uncontrolled cellular growth, we also perform additional stains. We can perform what's called immunostains, where we look at cell surface molecules. Often they're called cytokeratins or CD markers or tumor markers. And what that does is it helps us to understand the type of cancer that a person is affected with, not only the organ from where it comes from, but what we now know about cancer is it's a heterogeneous disease. It's not just one disease. What that means is, for example, is breast cancer is at least 100 different diseases, so is colon cancer. And by staining it, we can understand exactly what type of breast cancer or colon cancer it is. But we've actually moved on from an organ specificity. By that, what I mean is we've moved on from the French definition, which started in the 1850s, that cancer should be defined from the organ from which it originates. Now that's really helpful if a surgeon wants to operate on it, because they need to know the anatomy, or a radiotherapy doctor wants to treat it with local radiotherapy. But now what we're learning about is the best treatments are based on the molecular origins of those cancer cells and the molecular characteristics of those cancer cells. And by doing that, we can select exactly the right treatment. It's almost genetically guided treatment. We're not quite there yet, but we're on our way.